Hello, and welcome to the Pitt State Library Web Tutorials. Today we are going to talk about primary sources and how to find them. In your classes in the School of Nursing at Pittsburgh State University, you will likely be asked to look for primary sources for your research. In order to do that, you need to understand what primary sources are and where to find them. At this point, you might be asking why research is important. In the health sciences, advances in medicine and treatment come about through research into new treatments or modifications of existing ones. Practice guidelines that doctors and nurses use in treating patients are derived from that research. All scientific research is about answering a question or solving a problem. For example, in healthcare, that might be about finding a cure or treatment for a disease. You probably hear in the news all the time about how someone is doing research on a disease. The scientists often publish their findings, which are called research or primary sources. On this screen, we see a list of some keywords to look for when examining journal articles to help you verify if an article is a primary source. These keywords will likely be in the headline, the abstract, or possibly the article itself. They include objective, problem, subjects, method, data, results, analysis, discussion, and conclusion. Specific types of primary sources in medicine include clinical trial, randomized controlled trial, or case study. Research can be quantitative or qualitative, or sometimes both. The example on the screen now is a screenshot of a citation and abstract of a quantitative study. Please notice the keywords highlighted in red which I mentioned in the previous slide. We all know what quantitative is, numbers. Those would be things we could easily measure or quantify. Types of data gathered for quantitative research might be epidemiology, biometric data such as blood pressure, blood sugar, weight, cholesterol, or also comparing treatments or comparing a treatment to a placebo. The example article on the screen now is a screenshot of a citation and abstract of a qualitative research article. A scientist doing qualitative research would gather data differently than one gathering quantitative data. For example, scientists doing qualitative research may gather data from focus groups or surveys, where those doing quantitative research may measure a person's biometrics, for example. Qualitative studies use subjective data rather than hard numbers and also have a holistic focus. Lastly, the meanings of the qualitative data are extracted from the data and must be interpreted in context. Now that you know why research is important and what a primary source is, I should explain how to find a primary source. Some of our databases will allow you to limit to primary sources with the click of a button. With others, you can limit your search somewhat by using keywords such as clinical trial, randomized controlled trial, research, or study to help narrow the search to primary sources, but it is not foolproof. In addition, if you're looking for quantitative or qualitative research specifically, you can also use those words in your search. CINAHL, or Cumulative Index to Nursing and Allied Health Literature, is one database you can use to find journal articles in the health sciences, including primary sources. This screenshot is a small portion of the advanced search screen of CINAHL. Here you can put in terms for your search. Notice that I put in the search term neonatal intensive care unit. You can further narrow the search by putting in another term in the box below that. For example, you could do a search for neonatal intensive care units and co-bedding twins to find articles about co-bedding of twins in neonatal intensive care units. If you want to broaden your search, change the scroll bar that currently says "and" to "or" and put in an additional search term. For example, you may be interested in finding articles about toddlers or infants, which would allow you to find articles about toddlers or infants and perhaps some articles about both. Now on this next screen, we see a small portion of the CINAHL Advanced Search screen that shows the publication type box. To find the publication type box on the Advanced Search screen, you need only scroll down and look to the bottom right of the page. Within the publication type box, there are several available types qualifying as primary sources. For example, you can see clinical trial here on the screen. Case study and randomized control trial are two other possible primary sources that you can use to limit your search. In order to limit to any of these, you must click on the one you want to limit to and then click Search at the bottom or top of the Advanced Search page. PubMed is another database that is great for doing nursing research. You can see here on the screen that I have already done a search for neonatal hypoglycemia. Below that are the search results. To limit to primary sources in PubMed, go to the Limits menu available on the left side of the screen, specifically the section at the top that says Article Types. Click on Customize under Article Types and a list will pop up showing a variety of article types. Some of them primary source types I mentioned before. You can choose one or more of the article types listed. Using a limit like this in PubMed will assure you that you find a primary source. CINAHL and PubMed are just two databases that we have access to. You might be wondering where you can find a quantitative or qualitative article. To learn more about that, click here on this handout. Now, you should have a basic idea of primary sources and how to find them. If you have trouble, stop by or call the reference desk at Axe Library. Thank you.